In this crucial moment for our school district, let's take a step back and truly understand what's at stake. The question before us: are we doing enough to safeguard our students' mental health? First, let's hear from Board Vice President Kim Ansh, who voiced her concerns about the district's priorities and spending.
We're now halfway through 2023, and according to the results of the NJGPA, at least 23% of our rising seniors are not graduation ready. And I feel that we are becoming a psychiatric institution at this point. That's over $500,000. Then we need to spend more time and resources on educating our students.
Kim Ansh has painted a picture of a district in crisis. But what's the full story? Yes, 23% of rising seniors were not initially deemed graduation ready based on NJGPA test results in their junior year. However, historically, as confirmed by our superintendent several times, over 98% of these students do become ready and graduate on time. The district's excellent faculty and the strong support systems put in place ensure this happens. Distorting these numbers to justify slashing vital mental health programs is not just misleading, it's alarming. With approximately 50% of lifetime cases of mental illness beginning by age 14, the need for mental health support is clear and urgent. What we're seeing here is a narrative fueled by a political and personal agenda, putting the mental wellness of our students on the line. Are we willing to risk the lives of our young people for the sake of a misguided belief? Board member Vivian King quickly responded, highlighting the importance of mental health support.
So Ms. Ansh, if I'm hearing you correct, you're stating that you're going to vote no to a program that is going to help our students should they be in crisis and need the assistance of a mental health care professional. And I'm thinking that that's tantamount to some of the things that they've instituted in districts that have lower economic status than we are lucky enough to have here in the RIH district.
Vivian makes a powerful point here about the imperative need for mental health support in schools, especially for students who might be in crisis.
So I'm struggling to understand why we would want to vote no to something that would provide help to our students in crisis. Not every student feels comfortable going to their parent and asking for help. A lot of times students look to the teacher that has reached them in class. I'm a little shocked by this, I have to be honest. Our district is working on the whole student, the wellness of the child, and I think it's incredibly important that we support this program that our superintendent and our administration have vetted and have made the recommendation that we move forward with it. Thank you.
A student also cannot learn if they don't go to the dentist and they have a toothache. Have you ever had a toothache? Can you sit through a class and learn? No. There's plenty of people without dental insurance, myself included. I'm lucky enough to be able to afford to take my kids to the dentist. But what if someone can't? Are we offering dental care? What else are we going to offer? If somebody has migraines, are we going to have a neurologist in here? At some point, enough is enough. We are a school district. We educate our students.
Kim's analogy, however, seems to miss the mark. Mental health isn't as simple as a toothache or headache. Kim oversimplifies the issue and undermines the urgency of mental health support for students. It's a pervasive issue and the stakes are high.
Students aren't going to commit suicide because they have a toothache. I don't have dental insurance either. But the fact of the matter is that maybe the students aren't doing well because they're afraid to ask for help. We are in a crisis situation with our students right now. It's all over the news. It's in the statistics. There is an epidemic of depression amongst high school students. It's important for us to treat the whole child. They learn better when they're mentally prepared. And yes, you have a right to your vote. I'm just shocked by it.
Vivian understands the gravity of the situation. She knows that without mental wellness, there is no foundation for learning or community. But not everyone sees it this way. Vivian King and Amy Eilert's opponent, Audrey Souders, aligning herself with those wishing to defund mental health programs, misses the mark.
And I'd like to know, when you say that the students are in crisis, I'd like to know if you can define that in a manner that I can understand. That have there been 25 students looking for mental health services and they haven't been able to be provided? Like, I want to know what that means in a more concrete fashion. I wanted to add online financial literacy class. This is going to seem funny, maybe, but if you really think about this, and we're talking about mental health, and we're talking about young, impressionable children, particularly female students who are inundated with image and things on social media.
Audrey's commentary on a financial literacy class is seemingly out of context and out of touch with the gravity of the situation and the defunding of mental health services. Really nothing funny there. It is also important to note that alongside her running mate, Audrey has never publicly supported mental health programs, nor condemned the board's decision to defund them. Their strong alignment with groups opposing mental health programs in public schools speaks volumes. It is vital that we stay focused on what matters most right now, the mental well-being of our students. How can we, as a community, stand by while our children are in crisis?
And I'm just absolutely horrified by what just happened. How dare I not like what just happened? How dare I be offended by the fact that maybe my child will not have access to mental health if he needs it? How dare I? The fact of the matter is that you four have made decisions that affect the entire student body. You don't believe in it? You don't want your child to participate in it? Don't. What about the child who needs it? What about the family who doesn't know where to turn? You didn't like what you read in the OAL? That doesn't mean that someone else didn't benefit from the Thrive program or didn't benefit from the mental health facility they chose to go to. I'm absolutely mortified, horrified. I don't have enough adjectives to describe the disdain I feel right now for what just happened.
Vivian's passion is evident. She knows what's at stake. Her commitment has never wavered, even when faced with opposition.
But I'm not changing my mind.
And then there's board president Judy Sullivan, steadfast in her decision, despite the overwhelming evidence of the mental health crisis facing our students.
Ms. Sullivan, I just have one sentence to say, please. I'd like to give an opportunity to those of you who voted no. As Ms. Zeno pointed out, if you'd like to make a change and put it back on the agenda and vote on it again, this is your opportunity.
When given the chance to reconsider a decision that would strip students of essential mental health support, Judy Sullivan reiterated her opposition. So, where do we go from here? The facts are clear. The stories have been told. Our students are counting on us. As we reflect on the words spoken and the actions taken, it's evident where the true support for our students lies. Vivian King's and Amy Eilert's commitment to student mental health is unwavering, informed, and essential. In times like these, we need leaders who understand that student wellness is non-negotiable. The choice is clear. The stakes are high. By November 7th, vote for Vivian King and Amy Eilert for the Ramapo Indian Hills Board of Education.